Hey class, today I will be showing you guys how to do the precision and predictive medicine assignment. So the purpose of this assignment is to analyze how effective different kinds of antidepressants on patients with the given data. The information given provides genetic information from the patient as well as phenotype information. The difference between precision and predictive medication is that precision medicine is an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person. Whereas predictive medicine is the ability to prevent diseases, to treat patients before they become sick, and to encourage them to change unhealthy lifestyles make predictive medicine highly appealing for many people. So for Objective 1, we'll be covering how to create a table showing the relationship between anxiety diagnosis and response to citalopram, data in column with heading of CIT_success, and to report the rate of success for citalopram among patients with generalized anxiety depression. So to do this, we're going to open up the given Excel sheet, and we're going to go into Insert, and click on Pivot Table, okay. And in the pivot table fields, we're going to search generalized anxiety diagnosis and insert that into rows. And then for columns, we're going to search up the CIT success and insert that into columns as well as values. And in the values, we want to change the summarized by sum to count. To calculate the rate of success, click the value of the patients who have been diagnosed divided by the total. Then given is your rate of success, which is 32%. Moving on to Objective 2, which medication has the highest success rate when the patient has anxiety diagnosis? Report the rate of success for each of the medications. Give your opinion about why it is difficult to understand which medication works for patients with generalized anxiety depression. So for this objective, we're going to go ahead and find the rate of success for each of the medications. So going back to your given data, we want to go to Insert, Pivot Table, and we're going to do the same thing we did before, insert that into rows, but this time we're going to insert the different drug into columns and values. And we want to make sure we also change this to count. Given will be your rate of success. And we're going to go ahead and do this for each given drug. Then we'll compare which medication has the highest success rate. In this case, CIT has a success rate of 32%, which is higher than the others. Why it's difficult to understand which medication works for patients with generalized anxiety depression. Everybody's body can react differently to different medications. Some medications may work for others and some may not work at all. There's not just one medication that works well for each therapy. Moving on to Objective 3, which medication has the highest success rate when the patient has substance abuse? Use data in the column with the heading Drug Abuse Diagnosis. In this case, we'll do the same thing as we did before. Go to Insert, Pivot Table, and this time we're going to search up Drug Abuse Diagnosis and insert that into rows. Then we're going to put the name of the drug into columns and values, and we want to change sum to count again. There we have our rate of success for CIT. We're going to want to do that for every drug. Then we're going to compare which medication has the highest success rate in this case. And in this case, it's BUP, which has a success rate of 38%. Out of all the other ones, this one was the highest.